Okay, everyone, let's go and get started with a little bit of heart failure. Today we're going to go over left versus right heart failure. I'm Dr. Kendall Wyatt, and I'm the Academic Content Director at Picmonic. If you've never heard of Picmonic before, what we do is we take all the information you need to know and turn it into fun pictures. Now, it's not just pictures, but what we do is we take all the facts, turn them into fun characters, and then inside of a scene, it's taught to you with a visual audio system. The characters you need to know, like oxytocin, then oxytocin is going to become this octopus toe inside Picmonic. And of course, there's an entire scene to help you remember everything about it and how it works with pregnancy, so that you can always remember all the facts. Today we're going to go over left versus right heart failure. But first we're going to really go over some basics on how blood flow works throughout the body so that you can understand heart failure, because understanding it makes it super simple. Now, we're going to go over the components, like I said, the blood flow through the heart, and then we're going to go and compare the differences, left versus right. Super simple. Now, I like to teach everything as a body system, and I like to think of the fish tank method. You can compare the body to a fish tank. Just like a fish tank, it has all these great parts. It's got the fluid, just like the blood, and it's got the tank itself. And inside there are pipes that move everything around, i.e. air, which contains oxygen, just a lot like the blood. You can see how the body, and then pipes, and then of course everything needs a pump, the heart itself. And that's what we're going to talk about today, of course, when that pump fails, how it backs up. It's so easy to think about this stuff if you think about concepts of it, rather than just trying to memorize a bunch of facts. And as you can see here, it goes all together. Filters are just like a fish tank. It gets dirty. You need kidney filters. So just like a great fish tank should have, it needs a filter. So when you think about all together, you can see right here in the image, it goes all together into this beautiful working system, and one system helps the other. So they all work to compensate for each other. And that's how we have to think through compensation. So first off, I just want to talk about blood flow. Now, if we talk about blood flow, this is super important to make sure you just have to memorize this part to know what goes on. And I've got this little graphic here to help you talk through it. We've got the capillaries themselves, and the capillaries are the tiniest little ones. You can see them over here on the left. They're the blue. So the left little blue capillaries go into the veins, through the venules, into the veins, and then, of course, into the inferior and superior vena cava. Let me turn on my little clicker. Here we go. The inferior and superior vena cava. Now, everything is blue because it's deoxygenated, and it's flowing. Veins, essentially, they're not muscular, so they flow when you move. They flow when you move, and the blood flows moving. That's what actually helps the veins. Veins have valves, and those little valves keep the blood from going backwards. And of course, failure of valves ends up with a little thing called varicose veins, a very unsightly thing that happens in your legs, right? Very often in your lower limbs, because that pressure backs up on the valves and they fail. So when we come from the inferior and superior vena cava, then we go into the right atrium. The right atrium, then through the tricuspid valve into the right ventricle. Now, I never get my lefts and my rights very well together, but you just need to remember that this left and the right, we're talking about anatomical position. Don't get that one mixed up. So when we come to the right atrium and into the right ventricle, then it goes out to the lungs. Now, we know that from the through the pulmonary artery to the lungs, pulmonary artery is the only artery in the body that carries deoxygenated blood. It goes to the lungs, and in the lungs it goes again through the lungs and picks up oxygen. It's going to dump off CO2 and pick up some oxygen. And then, of course, it comes back to the heart itself to be pumped out through the rest of the body. So it comes from the lungs into the pulmonary vein. Again, pulmonary vein is the only vein that carries oxygenated blood into the left side of the heart. Now, the right side of the heart doesn't have to be it's not very big, it's not very strong, because all it has to do, that little lazy thing, is just pump a little bit of blood over to the lungs. And the lungs are just right next door. That's pretty easy. So the left side of there has to be big and strong because it's got to pump out through the arteries, out through the entire body for perfusion. So the left side of the heart is larger. Of course, if the left side of the heart fails, that's where we see not enough perfusion in the body. So we're coming in through the pulmonary veins into the left atrium. The left atrium, and then we've got through the mitral valve, and of course the left ventricle and the aortic valve out to the aorta. From the aorta out to the arteries, and then everything gets smaller to the tiniest piece, so it goes from the aorta to the arterioles, and then again back to the capillaries, where the arterial capillaries and the venous capillaries create that capillary mesh, and it all comes together, and that's where you can perfuse the tissues. It's super important to make sure you memorize this blood flow. Now, if you've got to understand the blood through the body, all you have to do is look at that little diagram or think about it in your head and say, well, where's the problem area? So if we think about exactly that problem area, then we're easily able to see that if a piece of it fails, then all the fluid's just going to back up right behind it. Just like if you have a dam, we put up dams to create giant lakes. So if we're talking about dams, they create a big pool behind them, and that's exactly what happens in the body if something fails, because everything fails because it's not pumping through it, so it just backs up all the way behind it. And that's where it's really important. And of course, then you can talk about interventions, which we're not going to go over today, but we're going to definitely help you understand the two differences. So when you talk about the different types of heart failure, there are 3 types of heart failure. There's not just left and right. There's also another one called high output heart failure, which we're going to talk about in the very last. So if we talk about left-sided heart failure, look at the diagram and say, where is that failure area if it's on the left side of the heart? Well, we're talking about the left atrium, the left ventricle, and we're talking about the mitral valve or the aortic valve. So problems on the left side of the heart. And if we've got them outlined right here, if we look at those little areas in orange inside of that box, we say, well, there's a failure there. So if it fails at any of these places, everything behind it is going to have an increased amount of pressure. So the pressure is going to build up behind it, lots of pressure behind there. Not necessarily pressure, but pooling of blood, because that's just where it's not moving past that point. It's like a roadblock or a dam. So then, of course, all the symptoms that you're going to see are all going to be in the lungs. So what are the big kind of lung ones you see inside of left-sided heart failure? Well, this is our Picmonic image. So if you've never seen a Picmonic, I recommend go and check it out. The screen animates for you inside of our system. It's going to teach you all about it, usually in about 2 minutes. And it's a little less winded than I am. But you can go in and you're going to see inside of here that there's pulmonary congestion inside of our left heart failure assessment Picmonic. So we are going to show you lungs with these cars that are all congested traffic, because the fluid backs up into the lungs, and then you end up with all those signs and symptoms that go along with it. So you end up with that pink frothy sputum. And you also see that you often see coughing. You may see wheezes, and we've got our wheezing weasel and then our crackers here for wheezing and crackles, which you may see. You may see dyspnea, difficulty breathing. We've got our little DysP lungs, as well as this characteristic nighttime coughing, especially when patients lay flat. So if you had a patient who has heart failure, a really good quick assessment tool to see the severity of their heart assessment is to say, hey, how many pillows do you use to prop yourself up at night to basically be able to breathe or keep from coughing? Because they're going to feel like they need to catch their breath, so they're going to prop themselves up. And that's because when we lie flat, of course, that pressure is going to build up even easier inside the lungs, because all the return of the body and the lungs and the lower limbs is pushing back on the right side of the heart with less, it doesn't require as much force. So you can use that kind of thing right there to help. So again, here's our pulmonary congestion, our little lungs character with our congested traffic to help you remember that as well. And when we talk about this, here's another good example of how it backs up. And I just put this in a linear example here for you. So if we're talking, this is a truncated version of everything that's through the body heart. And we've got the capillaries, veins, vena cava, both of them, right heart, and then we go to the lungs and then the left heart. And I've marked it in red. So then you can easily see here with the left heart being dead, our little Picmonic character, well then the fluid and all the signs and symptoms, almost everything you're going to see is all inside the lungs. It all backs up right there in the lungs. It's super simple because there's a low output on the other side. So let's move on to right-sided heart failure. So right-sided heart failure is different than left-sided heart failure. Well, duh, it's left versus right. But it's really easy to think if we look at that diagram of blood flow through the heart and we say, where does that fluid back up? So let's look at that diagram again. Here's the right side of the heart, all deoxygenated blood, and the left side of the heart, all the oxygenated blood, over here as well. So if we say somewhere in this area, the right side of the heart is going to fail. Basically, it's not efficient. Maybe there's a valve failure. Maybe you've had a previous heart attack and that area is weak. Maybe there's a cardiomyopathy because it's increased in size because of pressure, hypertension, or other problems, or any kind of ischemia or damage. Could be lots of different things. But essentially, that side of the heart is no longer efficient. Well, what happens? Well, then we've got, you see right here, the right atrium, tricuspid valve, right ventricle, and that pulmonary or semilunar valve. You're going to see the problems here. So where's the fluid going to back up? Well, it's so easy to just look and say, well, it's right behind it. And you're going to have systemic congestion. But why do you have that? Well, that's because all the fluid is, if we imagine, it's coming down from our toes, from our capillaries in our toes, and it's go all the way up through our veins, through the venules into the veins, and veins all the way to the vena cava. What happens? Well, that pressure it's got to basically just flow real easy. But if the right side of the heart's not pumping everything out of the right side of the heart very well, kind of got a roadblock and everything fills up behind it. Super important to really think about the concept, because then you can think about all the signs and symptoms. So here's the great little great diagram again, everything linear in exactly the same way. And here we've got the right side of the heart in red because that's essentially what's failing. Well, right side of the heart, well, then everything behind vena cava, veins, capillaries, and the body itself, there's lots of fluid backing up. So when the fluid backs up there, well, that means on the other side of the heart, there's not enough output. There may be decreased perfusion and decreased oxygenation possibly, leading to other problems. So here's a lot of our different characters from inside of our right side heart failure Picmonic. So you need to remember JVD, jugular venous distension. So that's JVD. It's all going to fill up in the veins, that fluid. And we've got our peripheral edamame character, all inside here animated to help you remember. Inside of a little scene, you can go and hear the great story about it to help you remember it forever. And of course, nocturia, another nighttime urination. A lot of because when the pressure builds up and everything builds up and everything, all the blood flow just kind of can't drain out. So another thing with right-sided heart failure is we've got a lot of weight gain, because essentially what happens is that means all the fluid's backing up and it's not getting circulated around as much. So you're going to see weight gain and sometimes even ascites, a big giant swollen up belly, just because of a lot of fluid just not able to easily flow into the inferior vena cava and then be pumped around the system. Anytime you have a patient with heart failure, what's the big thing to measure the heart failure? Well, you've got to remember those daily weights. It's really important to make sure you weigh a patient every day, because you can see that increase of fluid gain, and you can maybe then find a potential problem where there's a serious risk for severe signs and symptoms or an exacerbation of heart failure. Because what happens is the fluid overloads, you're not able to pump it out through the kidneys as well, and then you're saying, whoa, this patient's gained more than a pound today. That's a serious problem. So you can be able to weigh them every day, and that's a really common question that is out there a lot. Here's our right-sided heart failure Picmonic, all put together with that little scene. You can go learn about our jug vein character and these peripherally swollen edamame, all having a great party here. Now the last type's high output heart failure. High output heart failure is hard to think about, because it's how can you have high output but yet there's still failure? Well, this happens in a couple of different scenarios. Heart failure essentially happens not just when the pump itself fails. It essentially is when there's not enough oxygenated blood being pumped through the heart. So what happens with high output heart failure is that there may be a perfect amount of fluid volume, but inside of that blood, it's not oxygenated very well, or there's a severe problem. So we see this really common with sepsis. We see it really well with anemia. So anemia, there's not enough red blood cells to be able to carry oxygen, so then there's not enough oxygen getting to the tissues. So what happens? Well, the heart's able to pump up faster and move this fluid around, but there's not enough to meet metabolic demand. So then you have high output heart failure. And that's where we see a lot of patients with sepsis, with these tachycardias and all these fluids flowing around, lots and lots and lots, but it's not oxygenated well enough to get to the tissues to sustain a nice, normal, healthy tissue life. So here we got just a couple examples. We got our severe anemia here inside of our slide. And then, of course, another example is severe hyperthyroidism. Is just the fluid moving around too fast. So you have severe tachycardia, hyperthyroidism, your basal metabolic rate is increased. That means all your tissues need more energy and more oxygen. And another really a weird one is an AV fistula. Now, this is not a fistula from dialysis. It could be if it was malfunctioning, but this is an AV fistula, arteriovenous fistula, where essentially outside the heart somewhere, the venous blood and the arterial blood are spinning around, and they're not getting pumped back through the lungs. That's another one also to just kind of think about. Now, I love to put things together with a great little question. So let's try a question today. See if you can easily immediately just see how easy it is to think about using pictures to just quickly go out and grab the signs and symptoms. A 67-year-old female patient presents with left-sided heart failure. Which of the following signs and symptoms are most likely to be seen? Select all that apply. My favorite. Dyspnea upon exertion, pulmonary edema, peripheral edema, paresthesias, weight gain, weight loss, or jugular venous distension. Now, if we thought about this right away, think about yourself, left-sided heart failure. So that means somewhere on the left side of the heart is failing. That's maybe the left atrium, the mitral valve, the left ventricle, or the aortic valve. So anywhere on that left side, the heart's essentially failing. It's not pumping enough. So everywhere behind it, essentially, there's going to be a fluid backup. And what's behind the left side of the heart? The lungs. So all you have to do is think about the lung pathology that's going here, and then you've easily weeded out all the things that test question writers are going to try to throw at you, which are the opposites. So you can quickly look at this and easily just go through and say, well, a patient with dyspnea upon exertion, of course. Pulmonary edema, yes, pulmonary edema, increased fluid inside the lungs because of that fluid backup and excess pressure. So it leaks out. That's why you see that pink frothy sputum. And of course, weight gain. We see weight gain in all left and right-sided heart failure. Another important point to mention about left-sided heart failure is that left-sided heart failure, if the left side of the heart isn't working, that means the right side of the heart that's trying to pump the blood to the left side of the heart needs to work harder. It needs to hypertrophy and get bigger and work harder because the left side of the heart's taking a break, maybe forever. So what happens is left-sided heart failure ultimately leads to a failure of the right side of the heart. So left-sided heart failure leads to right-sided heart failure. Super important point to think about because eventually the whole system will fail. And that's why this is a serious problem that you can't just ignore. So here at the bottom, we've got all of the some Picmonics to help you go in. You can learn all about the interventions and everything else inside of Picmonic. I recommend you go try it out. And of course, check out a lot of our other videos. And of course, go try out Picmonic for free. You go to picmonic.com and you can try a free trial. You can see all these Picmonics and you can try the ones for heart failure. So that's all we've got. We appreciate you joining in today. Go ahead and check out some other videos. We've got lots of other topics and check them out. I'm Dr. Kendall Wyatt and good luck studying.